Hello friends, my name is Victor. I'm a practicing pharmacist. Today I'm going to be discussing how metformin causes weight loss. If you've noticed, most patients suffering from diabetes tend to lose significant amount of weight. So it is because of the diabetes or the treatment or their lifestyle changes. Definitely it's not because of diabetes, and it's maybe because of the lifestyle changes or metformin. So because as recommended by the physicians, if you are diagnosed with diabetes, you should be asked or requested or recommended to change your lifestyle. So lifestyle changes like avoiding sugary drinks, avoiding processed food, increase the level of exercise, intake of vegetables. So these various lifestyle changes can result in weight loss. But today I'm going to be telling you about how metformin can cause weight loss, because I have gone through a study which was done in April 2012 by and published in the Journal of Diabetic Care by the American Diabetic Association. So in this particular publication, it's being stated that adherent to metformin and as well as the side effect of metformin causes weight loss. Okay? So right now, I'm going to go through and tell you the real reason why metformin causes weight loss. Firstly, metformin is the safest and effective medication in the market for anti-diabetes treatment. Okay? So being the safest, it means that it doesn't actually cause hypoglycemia. So it regulates your blood glucose, but it doesn't result in hypoglycemia. But mind you, always take metformin after food, okay? Secondly, metformin reduces the chance of macrovascular complication. What do I mean by this? Metformin stops or reduces the chance of kidney damages, nerve damages, eye damage, as well as your heart damage. So this is why it has been used worldwide to help patients suffering from diabetes prevent certain macrovascular complication. Okay, and right now I'm going to be telling you the positive effect and the negative effect that causes weight loss after taking metformin. Let's start from the positive effect of metformin. In diabetes, there is persistent increase in blood glucose. We all know this. Metformin, how metformin acts and prevent this shoot in blood glucose. The one important mechanism or the one important way metformin do this is by it decreases the absorption of glucose from the stomach to the blood circulation. And the second thing is that it improves insulin sensitivity. So in most cases, you find that diabetes patients tend to have high insulin resistance. So there is high insulin resistance here. So the glucose in the blood doesn't get absorbed by the muscles, and the muscles don't work efficiently. So, but metformin, it helps you to improve this sensitivity to insulin and then making the muscles work more efficiently. All right. And the third point is that metformin also decreases the production of glucose from the liver. So with these three main mechanisms, you tend to absorb less amount of calories and then lose significant amount of weight. So this is one of the positive effects of metformin. The negative effect, I would say, is you've noticed most patients, like we pharmacists and physicians, we notice that most patients taking metformin initially complains of various side effects like diarrhea, stomach pain, nausea, loss of appetite. So this happens because of the negative effect of metformin, which causes various gastrointestinal disorders. So when this happens, you tend to lose your appetite to eat, and then you eat less amount of food. By eating less amount of food, you take less amount of calories compared to your normal diet. All right. So now you've known how metformin causes weight loss. Can metformin be used for weight loss in a normal person, a normal healthy person? The answer is no. Metformin cannot be used in a normal healthy person. The reason why I say this is because metformin, when used in a normal healthy person, it can disrupt the normal cycle of insulin. Okay? If you're struggling with overweight or obesity, I would suggest that you meet your dietitian or your nutritionist to help you come with a proper weight loss solution for this. Or you can follow the normal traditional strategy for weight loss. Alright? In this video, I will give you 3 important tips on how to manage this various side effects. As you know, this is very, very troublesome to diabetic patient. And what you can do here is that if you're having diarrhea can disrupt the normal electrolyte balance in your system. So it's very important for you to take an electrolyte replenisher. You can get this in your pharmacy, all right? The second thing is, second problem, which is stomach pain and nausea. Stomach pain and nausea can be treated and can be managed by a normal home remedy, which I prefer, like lemon water. But if you have other strategies for your own preference, you can always adopt that. But still, if you still cannot manage this, you can meet your physician, and generally they prescribe anti-diabetic, which can help you manage these symptoms. Okay? Loss of appetite. It is very, very important. Never skip meals. A diabetic patient should never skip meals, because when you skip meals and you're taking your anti-diabetic medication, you can go into severe hypoglycemic state. So what I recommend you is that always take your meal. If not the normal 3 square meal, you should separate your meals. Like, make sure that you take at least small portions of your daily meal, like 4 times in a day, or 5, separate into 4 or 5 times daily. All right, this will help you regulate your insulin balance. All right, and I hope this video find you well, and I hope you understand why metformin causes weight loss. And if you do have any query, feel free to comment below, and I will try my possible best to reply you as soon as possible. Thank you. Have a good day.